My name is Lindsey Moecia. I'll be performing skill set 19, which is the CPR skill. When we have a patient present to us in a critical state, if CPR is needed to be performed, the first thing that we would do is check the airway and make sure nothing is lodged in the mouth or throat that's visible that we can see, and chest compressions would be started. I would have a dog this size on the ground because I would not be able to give strong enough compressions at my height with him higher on a table. So I would start with compressions right here with his back against the wall so that he can't get away from me as I'm giving the compressions. I would give the compressions over the heart, go down, and then come back up. We would want 100 to 120 beats per minute for 2-minute intervals. While I start my compressions, the person that is assisting me would be getting an ET tubes placed. We have the laryngoscope if that is needed for visual, and then we would get the ambu bag hooked up to the end of our ET tube, and we would start our breaths for the patient. We would be giving a 1-second breath. We would want to have 10 breaths a minute being given to our patient. We would also be having another team member place an IV catheter, which we have in our crash box. We have everything we need for our IV catheters, scrub, catheters, caps, flush. We also have needles and syringes and blood tubes in our crash box, and then we have atropine, epi, Dopram in the lock zone within our crash box. After our 2-minute chest compressions, the person that is giving the breaths and the person that is giving the compressions would trade places. You would listen, see if you had a heart rate, and then continue the pattern. And you would do that until you either returned circulation or the doctor called it and you stopped resuscitation.